morning. My name is Lauren Riffenberg, and today my speech is about universal health care and why it should be implemented and established in the United States versus having the private plans distributed by employers and strict and limited government-funded plans such as Medicare and Medicaid that we see in modern time in the United States. So before explaining why universal health care is important and beneficial, I must explain what it is and why it differs from the United States plan of private coverage. So universal health care, in simplest terms, is healthcare coverage provided by the government to every citizen for any reason whatsoever, whether that be for something as minor as a yearly checkup, which is relatively inexpensive, or something as invasive as brain surgery, which can range up to millions and millions of dollars, without having to go into any type of financial ruin. This varies country to country. It could be different. The universal health care that the United States could establish is not necessarily going to be the same as Russia establishes. So as you can see in the text on my slide currently, it could be a single payer, a mandatory insurance provider, or a national health insurance. All are different, but they all provide the same level of coverage to every citizen, meaning that the citizen is not going to go into financial turmoil over the cost of health care. So with this system, most citizens pay a small yearly fee or a small copay for every visit that they make to receive medical treatment, and they can go to any provider that they want to. So citizens with universal health care are also not under any of the strict confines that are commonly seen with private healthcare insurance plans. So some of these restrictions include exclusions of multiple resources when it comes to realms of treatment, including cardiac surgery, eye surgery, reconstructive or plastic surgery, infertility services, and joint surgery. So to put this into perspective, there are about 500,000 open heart surgeries performed each year in the United States, according to Lifespan, which is a health system that works in accordance with Brown University Medical School. So with this figure alone, we can assume that many of these procedures were life-saving since they're cardiac, and we can also assume that the better half or the better majority of these individuals were forced to pay at least a portion out of pocket for their life-saving procedures, even with insurance. And those uncovered were forced to pay the full amount, which can stretch over $300,000 in many instances. Those with universal health care would pay a copay or roughly nothing at all. So the average annual cost of health insurance in the United States is $7,470 for a single individual and $21,342 for a family as of July 2020, according to the Kaiser Family Foundation. So even though most employers cover a percentage, usually under 75%, most often under 75%, and some covering none, this is a figure that really puts into perspective just how financially horrific healthcare coverage can be for a lot of families. With an average household income of about $60,000 a year in the United States, and many households making significantly less than that, on top of a really severe housing market shortage that we can all see today, this can mean unprecedented financial turmoil in many households. So this brings me to the topic of those who are completely uninsured. And here are the United States statistics for every state in 2019. So, and these are also the ones from 2018. So the Center for Disease Control regularly tracks and calculates the statistics regarding health insurance, and it's estimated that 11.5%, or some 31.2 million people, will have been uninsured for all of 2021. To put this into fruition, that's about 3.5 times the population of Michigan. So we've seen over a 2% increase from the 2018 statistic to the 2019 estimated statistic, providing evidence that some households may be forfeiting their access to health insurance for the ability to have access to housing. So without this access to affordable health insurance, many individuals either take an insurmountable debt to pay back their health care costs or simply avoid health care at all costs. So some even avoid life-saving treatment or medication because they simply cannot afford it. So Justin Kimball, the quote-unquote founder of what we know today as health insurance, proposed his first plan in the 1920s to allow educators in California to prepay $6 a year or 50 cents every single month towards the Baylor Health System. And this would cover about a 21-day hospital stay, no matter what happened, if you had a child, if you had brain surgery, if you had a heart attack. So majority of the educators forewent this proposal, about 75%, but no one really had even the slightest idea that it would turn into such an inaffordable and chaotic circumstance. So universal health care is dependent on universal agreements to accept a policy. So this becomes a political issue in a democratic society that we live in, since much of the funding for universal health care comes from taxes, which is a small price to pay for the lives of millions. It also becomes a moral conflict when individuals aren't willing to believe that every individual should have access to health care. So this is commonly seen in individuals who are extremely conservative, who may not be educated about the effects of poverty, the effects of middle class. So, and individuals that are middle class often receive the least amount of help. So they don't get tax breaks. They also don't get any form of Medicare or Medicaid if you make over a substantial amount of money, which is anywhere from $4,000 to $6,000 a month, which is still not technically livable if you have a family of 5. So it does need to be really clearly stated as I speak that healthcare is extremely complicated and extremely finicky. So government spending would have to increase in order for the United States to adopt this system. Universal health care is not 100% coverage and probably never will be by the government. According to Decision Data, a team is dedicated to provide statistical evidence to Decision Data is a team dedicated to provide statistical evidence. Quote, universal health care would save the people of the United States about $600 billion for the same level of care they're receiving. And we found that it would require an additional $562 billion in taxation to cover the government spending after savings and increases to demand, unquote. The better majority of the United States are willing to forego this tax increase for the good of an entire country, roughly 57%. So without access to affordable health care, many will go without needed medication. 2 of the most prescribed medications include Advair and Lantus, as seen above. Advair is an inhaler, and Lantus a medication prescribed to treat diabetics. It's a form of insulin. So over 10 million of each medication is prescribed per year. Lantus is about $300 a pen, which lasts from 2 weeks to about a month. And Advair is about $200 for a 14-day supply. Overall, I believe universal health care should be a right offered to all individuals due to a rising cost of health care and a rising cost of insurance. And uninsured individuals, I believe it should be a universal right to afford medical treatment regardless of status and income.